Health insurance premiums will rise by an average of nearly 4% from April in the latest hit to patients' hip pockets. It follows lengthy negotiations between the industry and the federal government, and it comes as the Health Minister concedes something has to be done about rising specialist fees. Alison Branley from the Specialist Reporting Team joins me to discuss what has certainly been a big week in health, Alison, with all the announcements ahead of the federal election campaign. So exactly how much are health insurance premiums going to go up, do we think?
It's lower than health inflation, but higher than general inflation. The highest rise in the past 5 years was 3.95% in 2018. So it's on the higher side, but it comes after the Health Minister, Mark Butler, went back to insurance companies 3 times to say, no, it needs to be lower before I'll approve it.
Right. So is this likely to help with rising medical costs, especially at places like the specialist's office, where we all get referred to really multiple specialists when it comes to key concerns about our health?
Well, I think a lot of people are going to now be asking about the value of their private health insurance. That's certainly what we hear from patients all the time, that they're really doing the sums and working out whether it's still value for money for them. We're hearing a lot from patients about rising costs at the specialist office, because in the recent pre-election announcement, we've heard about $8.5 billion going towards extra bulk billing at GP offices, which has been welcomed. But for a lot of patients, the bulk billing rate at specialist office is 28% compared to 77% at a GP. The average out-of-pocket $115 compared to $46 at the GP, with patient groups saying it can be up to $750 just for a standard consult. So anyone with any level of complex care, even a minor chronic condition, is really feeling it when they have to go to the specialist office.
And so what are all sides of politics saying and pledging in terms of these specialist costs? Are they promising anything?
Well, when it was put to Minister Butler yesterday in Hobart, he did concede something has to be done, and he said as much to the AMA about specialist fees. Anne Ruston, the Shadow Health Minister, she has agreed, yes, there is more to do, but there hasn't been anything particularly concrete when it comes to specialists. The Greens have announced that their policy is to fund a Medicare rebate for ADHD and autism assessments that will be able to be billed by a range of specialists like paediatricians and psychiatrists, and they're saying they'll make it a generous one so that the patients can be bulk billed.
Yeah, I think all voters looking to find a cheaper way and, importantly, not put off medical treatment, because that's really what we're talking about, aren't we? Can I afford it, and can I afford to put it off?
And patient survey after patient survey is saying exactly that. Patients are going without food or fuel, or they're simply delaying healthcare. So putting off those specialist appointments, not going for those scans, just delaying healthcare. And then what happens is they end up hospitalised because whatever that condition wasn't treated. So ultimately there's some economies here that have to be worked out by the powers that be, because really healthcare delayed is healthcare denied.